Migraines can be painful, debilitating, and unfortunately alter negatively the lives of migraine sufferers. So if you or a loved one is suffering from migraines, then this video is for you. On this video, I'm going to be covering the new model of understanding migraine headaches and how that applies to the main migraine triggers. But before we get there, I'm Dr. Kresimir Jug, structural chiropractor from London, Ontario, Canada. We help people regain their health and recover from spinal-related health problems through the power of structural chiropractic and life by design principles. Now, everybody who has migraines or who has suffered with migraines knows about migraine triggers. These are things that you consume on the outside or you do to yourself on the outside, and what they do is they cause your body to have a migraine headache. Now, the old model of thinking about migraines, now, before I go into this, I recorded a video on this already, so depending on what platform you're watching this, it'll either be the first link in the comments below, or I'll try to get a link to it here so you can watch it. But the old model had everything to do with migraines are caused by blood flow, by blood vessels in your head dilating or contracting depending on the stimulus that you're consuming, right? So the idea would be, you'd consume caffeine, and caffeine would restrict the blood vessels, I'm having trouble talking today, the blood vessels in your brain, and that's what would cause the migraine. Now, as we're learning more and more about migraines, we're starting to understand, and we're developing a new model for understanding migraines. And the new model has everything to do with nerve system sensitivity. And what that means is migraine sufferers tend to have a more sensitive or hyperactive or overactive nerve system, meaning that it takes less of a stimulus to trigger a migraine headache. Now, as a crude example, right, picture a friend who is overly sensitive and gets really offended or upset by even the smallest things. So, that's typically how a migraine sufferer's nerve system would react. It takes a lot less to put them over the edge than somebody who has I don't like the term normal because I think we're all normal, but a more average active nerve system. Now, we all know the classic triggers. I mean, there is variations in migraine sufferers and what their triggers are, but we know the classics: caffeine, lack of sleep, medication, overexertion, alcohol. We know those things, but as it turns out, and what we're going to be talking about on this video is it all depends on how your body interacts with these substances on whether or not you're going to get a migraine. So here's where things get really interesting. And I want to be clear, the data is still coming out and we're learning more. So what I'm about to share with you is more clinical information from what I've seen with my patients. Now, if we were to divide the triggers, it seems like triggers for migraine sufferers come in two forms. There's the absolute triggers. And what I mean by an absolute trigger is it's a thing that you do or take, alcohol or exercise or whatever it is for you. And it's different for everybody, that there's a high likelihood it's going to trigger a migraine, like 100% or just a little bit less. But then there's those relative triggers, right? So sometimes you can do them, or sometimes you can take them, or sometimes, you can swallow them and it doesn't cause a migraine, and sometimes it does cause a migraine. So here's where things get super interesting. If the new model says that nerve system sensitivity is what's at the foundation of you getting a migraine, and there are things that there's two ways that we can approach this problem. We can either avoid the trigger, which has been like the traditional model, or what's really interesting and what we're seeing with our patients in our clinic is we can change the sensitivity of your nerve system or make it less sensitive. What that would mean is these triggers will become less effective in causing you a migraine headache. So that begs the question, how do we make your nerve system less sensitive? Well, the first thing that I would like to throw out there is if something is a very strong trigger for you, meaning that if you do it or you consume it, the likelihood of you getting a migraine, the best short-term strategy in this case is to try to avoid that thing or to eliminate that thing altogether. Okay, so if it's a high likelihood, then get rid of it altogether. What I'm going to be doing for the rest of the video is I want to share with you and I wrote it down, so I want to make sure I'm reading it's not that complicated of a number, but there's 4 strategies that I would like to share with you that we have seen with our patients that have helped their nerve systems resensitize or at least become less sensitive, and that's helped them deal with life better and have typically, on average, less migraine headaches. Now, these are in no particular order. Which one is going to be the most important one that you do that gives you the best result varies from case to case. It's different with everybody. So this is there's easier and there's harder. So they're not in that order, but I can tell you which ones are easy and which ones are hard and been tough for people. But the first one that I wanted to share with you is exercise, specifically strength training. Now, when people say exercise, so here's what we know. We know in the world of rehabilitation that the best way to heal an injury or to heal structures is through strength training. That's a lot of ths and rs, is through strength training. Now, what I mean is we used to think that for example, if somebody injured their lower spine or if someone injured their knee or their hip, the old thinking, it's funny how we're breaking down these models and creating new, better models on top, but the old thinking was we needed to stretch, they need to do more mobility, they need to become more flexible. There's still lots of value in that. However, when we're looking at, again, the new data and the latest research, strengthening the structures or becoming stronger is more effective at rehabilitation and holding holding your body or helping your body heal. Now, when it comes to a lot of what you guys are doing, and this one ties into number 2 very, very closely, it ties into structural chiropractic, but a lot of us are spending time with forward heads, and we're not doing enough to strengthen these structures, your upper traps, your upper back, and your neck. We're not doing anything to keep those structures strong to, for lack of better terms, the stronger you are, the more stress you can handle and the less stress damages your body. So strength training is absolutely vital to strengthen your neck to help with migraine headaches. Number 2 is structural chiropractic care. Now, structural chiropractic care is very different than traditional chiropractic care. None of them are better or worse. It all depends on what you're looking for. Now, a traditional chiropractor is very good at handling aches and pains. A structural chiropractor, and what we do is we're looking for structures. So it's really important. For example, I'm showing you a cervical spine here, and it would be a cervical spine on an x-ray if you were looking at me like this. So it's important that there's a 40-degree curve, about 40 degrees in your neck. It's important that things are lined up, because if they're not lined up, if they're shifted, what they can be doing is that they can be putting uneven pressure on your spine and on your nerve system. Now, here's why that matters, and here's how that negatively affects your nerve system. If you're dealing with this, it's twofold. Your spine is extremely important to your body. So what your body does is it makes it a high priority of healing, and it sends a lot of extra energy to deal with the spine. So it's very metabolically demanding, which raises, and when things are highly metabolically demanding, it raises the sensitivity of your nerve system. The other thing that it does is it's pressure on your nerve system, which increases the sensitivity of your nerve system. So making sure that the structure of your spine, and most people have no idea. They have no idea what their neck looks like on the inside. They have no idea what the curvature of their spine is. Nobody's ever bothered to look. So may I humbly suggest that you look and that you learn what it actually looks like on the inside. Number 3 is managing stress. Now, this one is extremely deep and extremely difficult and out of my scope of practice. However, it's extremely important that there are, and it's hard to do, it's so hard to do, but it's extremely important that you have a way to release stress from your life, that you have loving relationships, that you have a purpose, that you work at a job that you like. It's important. Like, stress is always going to happen. Life is very challenging, but the more you can get yourself in a place where you're feeling good about your life and your surroundings, the sensitivity of your nerve system decreases, because your body can sense that it's in a better place. It's very similar to the fight or flight response. When somebody is in a constant state of stress, the sensitivity of their nerve system is much higher than it needs to be, because their nerve system has to react to the next stimulus that they experience. So learning to, and again, this is such a varied response, but it's important that we look at our life holistically. It's important that we look at our life, not just the physical ailments, but also the emotional and the spiritual ailments that we could be working towards, because it will help, in this case, with nerve system sensitivity and migraine headaches. And last for the video, but definitely not least, is reducing the all load inflammation on your body, right? So we understand and we know that migraine sufferers have food sensitivities, for example. one of the best ways to lower the inflammatory load and to improve the food sensitivities is to focus on eating a whole food diet, right? So, and again, there's supplements that help. Fish oil is good, and magnesium is a good supplement, and drinking a lot of water, and we know these things, and supplements are great. But honestly, you can't out supplement a less than optimal diet. And the poorer the nutrition, the more the processed food, the higher the level of inflammation. And if the level of inflammation is high, again, that increases nerve system sensitivity, because very much like the other three that I talked about, inflammation is very metabolically demanding, and it's important that your body clears it out. So a lot of your nerve system's attention will go through doing that, which leaves less bandwidth to deal with things that could trigger a migraine for you. So that's it for today, guys. There is obviously a lot more to be said and to be learned about this topic. If you have any comments or questions, please post them below. I would love to help. I would love to answer any questions that you might have. If I can ask you for a favor, please like, share, and subscribe. And when I'm talking about sharing, actually think of somebody who might need to see this video and send it to them, because I think it could help. Talk to you soon.